Hi, this is Dr. Jean-Baptiste. I am speaking to you about the prevalence of diabetes and peripheral arterial disease, particularly in the African American communities. And diabetes in particular is very prevalent. And unfortunately, because of the history of African Americans with the healthcare system in the United States of America, there's a huge gap between the diagnosis and treatment of all diseases, but in particular diabetes that we're talking about today. Between the general population and African Americans, we are frequently diagnosed at a later stage of all disease processes and aren't unfortunately offered the same treatment options as people from different ethnicities. And that's adjusted for socioeconomic background as well. So just because you might say, well, it's an education thing, people who have college degrees and are African American are frequently shunted towards less optimal therapy for disease processes across the board, and diabetes is no exception. Unfortunately, particularly here in Kentucky, where there's a high rate of amputations, frequently see patients with below-knee amputations who've gone to other providers and weren't even offered an option for any kind of therapy, be it surgical or endovascular. And so, modern vascular, and my goal is to try and change that trend.